you want him up here, because I'd like to get,
Sure.
if you have another chair for us.
Absolutely. We will get another chair.
Okay.
Can you get another chair? Thank you. Great. Welcome. Good morning.
Good morning. Tom.
Thank you all for coming. Because, not that we're counting down, but 7 days. We are here because there are 7 days left for the 1.3 million Ohioans to sign up, to shop, to study, to see what's best for them and their families, and to have the chance to buy affordable health insurance here in a very historic first time in our nation. You know, thanks to the Affordable Care Act now, over 1 million Ohioans are eligible to shop on the website, which is working really well, to see what's best for them and their families. And the good news is they will find there about 46 plans on an average that are available to Ohioans for them to research and see what is the best choice for them and their families. That is also good news in that a family of 4 making about $50,000 a year in Ohio will be able to find a plan that's $156 a month or so. It is affordable health care that gives great health care and great health security. So now is the time, with 7 days left, and yet we are finding that so many Americans do not know yet about this new opportunity. And that is why we are here today, and why I'm so grateful for the leadership of your elected leaders here, who I am proud and will be introducing now in the next few minutes for them to speak about the importance to citizens here in Summit County and Akron and Canton and the communities around in this area. But in addition to having this excellent opportunity to buy affordable health care, there are people who are probably going to have questions. This is a first time, and so it's understandable. And there are lots of places here locally with wonderful experts to get assistance. And I'm going to mention them again at the end, but let me just start with saying that some of them are sitting right here in this room, like Don and Elizabeth, the fabulous people at Access behind them. So we have county people, we have the health clinic people, we even have Councilman West, who's a certified assistance counselor. So there are lots of places locally where citizens can go and talk to a real live person, ask questions, or call a phone number, which again I'll give in just a few moments when we're finished here. But finally, one piece of that I'd like to especially reach out to are young people. One thing that surprised me and may surprise some of our listeners is that the largest group of uninsured in our country, and it's true right here in this community, are young people between the ages of 19 and 35. And they are about 4 out of 10 of the uninsured. The good news for them is their insurance cost for about $50 or so a month for 6 out of 10 of them. So it is a very affordable product. And our goal here, especially in these next 7 days, is to reach them. So if every one of us older persons can reach a younger person in the next 7 days, we will make a big difference in the quality of their lives. So thank you again all for coming. I am very proud and grateful to introduce the Summit County Executive, Russ Pry. He reminds me that we knew each other years ago in my former life as a county executive, but please don't hold that against me. Thank you so much, County Executive, for your leadership here in Summit County and on this important issue. Thank you.
Yeah. Thanks, Kathleen. It is great to be here today. Primary health care is so important in our community, and for so many years people have not been able to have access to primary health care. With the Affordable Care Act, we're going to be able to see a lot more people have insurance, and they're going to be able to go out and get primary health care, be able to go to doctors, get medical conditions treated. And it's why it's so important that people need to know to sign up in the next 7 days for this kind of a coverage. You know, it's going to be able to cover pre-existing conditions, so it is really important to go out there and sign up for this. In addition to the federal website, you know, my people at Job and Family Services are encouraging people to use the Ohio site, which is benefits.ohio.gov. And again, that's benefits.ohio.gov. They're telling me that we have really good success with people going to that site to sign up. So it's something that I would really encourage people to go out and do. I talked to Dave Jennings this morning over at the library. Dave says, you know, they've got computers over there. If people need to go online, please visit one of our fine libraries, because we have access at our libraries to help people to also sign up over the next 7 days. So thank you, sign up, and let's get health insurance for everybody.
Thank you so much, Executive Pry. When I phoned the mayors of Akron and Canton in the last couple weeks to see if they would be able to step up here and help reach out and educate, reach their citizens here, both those mayors could not have been more fabulous and said, you betcha, we got to do whatever we can to tell people about this important opportunity, given we are so close to down to the wire. So I really appreciate Akron Mayor Plusquellic here hosting us in his great city, and Mayor Healy for coming up from Canton to join us here to help get the word out. So with no further ado, Mayor Plusquellic.
Thank you very much. And excuse me, I just tell you that Mayor Healy called me to see if he should agree to helping on this effort. He takes good advice, but I told him not.
I don't recall the conversation being that way.
I told him not to stay as long, get out of this business before he looks old like me. But it's good to have the mayor here. We've been good friends for a long time, and we do talk about it and various things. And he's doing some great things in Canton that I actually call and try to steal and do here in Akron. So it's good to have you here as we join together with the council person from Canton, and I see Rich Swirsky, city council person, new city council person, Tamala Lee from Summit County, and joining with Russ Pry is not something new for us, for me in particular. We have a great relationship and work together on many, many things. And so this is an effort to try to get as much as we can the word out in a period of time that sometimes, and I'm like that, I will admit, I need a deadline. And I usually do it maybe 1 minute before midnight, right before that deadline comes. And there are probably a lot of people out there. But this is an important issue. And I know that many of you have read that a group went from this community, professionals, doctors, hospital administrators, Tom Strauss from Summa, Russ and I and others, to go to Cuba to look at their medical system that really looks at keeping people healthy. And that is, in many ways, what the Affordable Care Act is doing and how they do that and what they do to be able to bring insurance coverage and make certain that, as Kathleen said, that everyone has that coverage. And then we look at how we can change our system to keep people healthy rather than on a system of eat more, smoke more, drink more, come in and have more operations and take more pills, which probably really and truly isn't the system we should be on. But unfortunately, the way our health system is based now in terms of pay for service, it's a joke, but it's sort of true. And we need to shift that and keep people healthy. In the first sign-up period, that is important for people to get that insurance coverage as we start to shift our attention on how to keep people healthy. I think all of our residents need to know, and sometimes mayors talk about one of the most frustrating problems that we have is how do we get the word out? I have said this, having been in office now for over 40 years, that it used to be simple. Everyone read their hometown newspaper. There we had 3 TV stations, and there were only a couple of radio stations that people listened to. Now we have 350 TV stations, but I think the public, unfortunately, knows less today than it did back then because we're bombarded with information and they don't know what's important. Well, this is vitally important, and I would urge all of them. It doesn't matter what their political persuasion, it doesn't matter what age or what income strata they're in. This is an important issue for them, and that marketplace and the website that Kathleen referred to will be able to help them get the insurance and health benefits that they really deserve and that they need, and we all need to emphasize that. So I appreciate everyone coming here together to try to get that word out. I know there are some very responsible folks in the media and the press, and I hope that you'll help us. And with that, I'll turn it over to Mayor Healy, and once again, welcome you. Thanks.
Thank you, Don. Appreciate it. Thank you. It's good to be here with my friends from Akron and Summa County, and we do a lot of work together, and we fight hard for Northeast Ohio and this Akron-Canton region. But this is a national issue that we're talking about today, and it's kind of interesting because we spend so much time on the local stuff to really focus in on what's happening at the national level. That's so important. We had to step back and say, wait, this is something that needs to get our attention, even though our responsibilities are not at the federal level, they are to the people that we serve. And there's nothing more important right now than the ability to have access to affordable health care, and that's why we're here today. You know, there's a lot of politics that goes along with this issue. And I know that, I don't know, but I've heard there was the same types of issues that happened when we brought in Social Security or Medicaid or Medicare. When those issues first came to be, there was a lot of discouraging comments and a lot of chatter that made it very, very confusing. And quite frankly, I don't know that any of us up here totally understand everything that's going on. And for the public out there, we understand it is confusing. What we want you to do is to, one, be aware that this program has a deadline that is the end of this month. And if you don't understand it, call in, go to the website, go visit one of these sites, and ask questions. When you're talking about being able to get affordable health care, you're talking about $50 a month or $100 a month for in different cases, or $150. Those are really, really inexpensive programs depending on your circumstances. But what I can tell you is, for those people who currently have no health care, they avoid the doctors and the dentists, and they don't go in until they have an absolute emergency. And then what they do is they go to the emergency room, which costs 10 times more than going to see a doctor ahead of time. Preventative maintenance is preventive health care maintenance, it's so much less costly than getting sick and have to deal with the issues. And so by having access to health care, you'll be able to go visit a doctor on a regular basis and do your checkups and go get your dental appointments and those types of things that matter to help you prevent bigger problems down the road. And if you think about this for a second, and I've never heard anybody talk about this from a standpoint of why it's important, but if we can take hundreds or thousands, or in this case, millions of people off of the emergency route healthcare method, which is going to the emergency room, and get them to go visit regular doctors and prevent, the cost of operating a hospital is going to go down significantly, because they're not going to be caring for uninsured emergency patients that can't afford to pay. They're going to be dealing with people that have health care, and then the average cost of health care at that hospital should be reduced, because everybody is contributing, as opposed to a big portion of them using the emergency care unit and not being able to pay the bill. Because somebody's paying that bill, and that's everybody else. So we do have an opportunity for the average cost of health care to go down at the hospitals if we have more people participating in affordable health care. And so it will be lower for the individuals, and it should translate into a lower cost for everybody. And I'm watching very closely, because I work with our hospitals in Canton, and I know what portion that they have of unpaid clients that come in for their needs, patients. And we need to address that as a society, but more importantly, as an individual, you need to have those preventative maintenance abilities for your health care, and this will do that for you. So just know the deadline is coming up. It's 1 week away. Once this deadline hits, it's going to be 6 months to a year before you get another opportunity to sign up. So don't waste this opportunity. Call in and find out about it and see what you can do to help yourselves. Thank you.
Thank you so much, Executive Pry and Mayors Healy and Plusquellic. You've all given a long, important list of why it's so important for people to, in the next 7 days, shop and take advantage of this incredible new affordable health care that exists to them. One of the statistics and points that Mayor Healy was just making about how just one piece of the law alone in getting preventative services could make a profound difference in people's health and in our overall cost. Already under the Affordable Care Act, thanks to the provision that requires that certain preventative measures be available under our health plans at no cost to us, like high blood pressure screenings or cancer screenings. Already over 2.5 million Ohioans have had one of those free no-cost services. So already the law is making a difference right here in this community. But probably one of the people who knows the most about what this law is doing already in this community is this facility right here. So I want to thank Summa for hosting us today and for all the work that Summa provides every single day for better health care in this community. And one of the leaders here at Summa is Dr. Joseph Varley. He's the James and Venita Olschlager Endowed Chair for the Department of Psychiatry right here at Summa Health System. He sees first day some of the ramifications of those who don't get the health care they need. And I'm pleased that he could join us this morning. Thank you, Doctor.
Thank you. When Tracy called, Tracy Carter, and invited me to speak, I said, they want a psychiatrist?
Politicians, we need that.
Well, see, so many possibilities come forward when a psychiatrist is in the room. So I'm especially grateful to be here, not only to speak from a physician's perspective, but also from a mental health professional's perspective regarding this important new transformation. Independent of politics, clearly, the way that we were managing healthcare in this country had to change one way or the other. It was unsustainable and deeply inefficient. So the fact that there is a transformation underway that provides people access to care is so vitally important. And it is so long overdue that I don't think we can get the word out far enough or wide enough for people to take advantage of this opportunity to get access. And then, as the mayor mentioned, access to what? It's not the old system. Things are in quite a bit of transition, and the focus on wellness, prevention, chronic disease management, and dare I say also integrating mental health concerns into the primary care settings are very important aspects of a new era in healthcare. That I think it's going to be a long road getting there and a lot of pain in the process, but those are very important things on the horizon that I think speak well for our country and for what we're trying to do and for the need that's out there. So I very much appreciate the opportunity to speak to that and look forward actually to a time when mental health is considered an integral and normal part of good, sound medical care, because believe me, it is. So thank you very much.
Thank you. And let me just close here by reminding all of our listeners that there is local expert help right here available over the next 7 days that people can access. And let me give you 3 examples. One is in Canton, at the Richard Watkins Canton Community Clinic that has daily enrollment hours that people can use for the next 7 days. In addition, we have the Summit County Public Health Department and the City of Akron are partners on a variety of enrollment opportunities. And one of those is tomorrow night at the main public library. And we have county health officials right here, Don and Elizabeth. Raise your hands, so if people have questions, they can come and talk to you. And a third example is the one that Access, please raise your hands, are providing each day for the next 7 days as well, including a clinic that they have next Saturday in Kent. At the Access Point Community Health Center is doing there. So many opportunities besides the 3 examples I just gave. You can call 330-926-5660 and ask for information about what's closest or nearest to you. You can go on the website as well, and you can call the toll-free hotline for the federal government 24 hours a day, 7 days a week. And that number is 1-800-318-2596. So let me thank you all again for coming. I want to thank the county executive and our mayors here for their incredible leadership in helping get the word out. 7 days. We're all, I'm sure, happy to answer any questions that the media might have.
If an uninsured person has a, say, an automobile accident in June, who's gonna pay for their medical expenses?
All of us.
They will not be held responsible for that?
Well, sure, but if they don't have the finances, then as several of the speakers have said, that cost all goes to everybody else.
Is
But
that anything different than right now?
correct, and so uninsured people will have the same health problems if they do not get insurance, and they will have the same fiscal problems if they do not get insurance. That's why we're trying to get the word out
If they're
here.
on the insurance and they have an accident?
I beg your
Are
pardon?
you asking if they're on the insurance and they have?
No,
an
if
accident?
they're not.
Uninsured.
Uninsured, okay. Right. Yeah, nothing changes if they're not insured.
Does Medicaid have the same deadline? Do you have a?
No.
Okay.
There is no deadlines for Medicaid.
Okay.
There's always every day open enrollment for Medicaid, as Medicaid program has been for decades.
Okay, thank you.
Does this kick in immediately if you're to sign up? When does your coverage start?
Generally the month following when you have enrolled.
For those who maybe tried to sign up early on in the process and ran into problems, should they go back and try again just to make sure everything is working well, or?
Right, if they have not received their insurance card, for example, in the mail, they should call the insurance company to make sure that they are enrolled as they believe they are. If they tried before and like last November and weren't able to finish the process, they should finish the process now.
Okay.
There's still 7 days to do so.
Are the websites able to handle all these millions who are unsigned?
Well, the website has been working really great since last December 1st. President Obama and Secretary Sebelius had promised they would fix the website, and they did by the date they promised. So it has really been working very smooth since then. And our biggest test of that was December 23rd, which was the deadline to sign up if you wanted your insurance to begin January 1st. And on that one day alone, there were 2 million people on the website on December 23rd. So we believe it's working well, but we hope that people will do the calls any time of the day or night here for the next 7 days, and there are all these assisters trained and ready to help people.
What happens if there's a rush and the sites do go down?
Well, we believe there'll be a rush because, as one of the mayors said, deadlines drive us all to doing things. But so far, we have no indication that there'll be any trouble with the website. Maybe it's just to more fully answer your appropriate question, which was, I think that the Center for Medicaid Services has already publicly announced today, just like in December, if people were on the website on the 7th day from now, on March 31st, trying to get in, they will still be able to do so as long as they were on the website trying to get in.
So if a Tuesday comes and they haven't signed up.
But they were in the
Monday,
website trying to do
they'll have
it.
another shot on
Correct.
Tuesday or whenever.
Correct. Correct. Did you have another?
Yeah, let's say I have insurance now, I lose my job, I could sign up later because there's provisions for a qualifying life event, right?
Correct.
Okay.
There's a list, it's on the website.
Okay.
Great. Well, again, thank you for coming out. Thank you, executive and mayors, for your leadership and helping get the word out. Very much appreciated.
Does the doctor have a card you could give